Any volunteer? Anyone?
ماشي ممكن نبتدي أنا.
Okay, so you can start, Dr. Muhammad. You can see the screen now.
Yes.
Okay, it is important if you attend the exam before, you have a paper, you write that you are Dr. Richard. If you miss the name of the doctor, just tell your name. You are SHO for Mr. Wolfson, and you will be called Mr. Charles, IT, intensive care or intensive trauma unit registrar, to tell him about booking for post-operative case. You already have 5 patients in ITU or ICU. So you have 5 patients related to surgery in this unit. This patient is 73 years old, woman, had sudden abdominal pain, confusion. On examination, suspected perforated viscous. Urgent laparotomy will be done. She is chronic obstructive pulmonary disease or airway disease, acute renal failure on dialysis. Her blood investigation, arterial blood gases, ECG is done and it is down, attached. Vital signs, blood pressure 130/80, pulse 120. Send the blood sample for group and safe. Send the sample for full blood count, blood sugar, arterial blood gases. Abdomen is rigid, tender, mainly in epigastric region. X-ray is done, we show it down. No allergy, no history of diabetes and hypertension, and full blood count, hemoglobin, and the white blood cells is 11, not so high. Hemoglobin is 12. Hematocrit, platelets, lymphocytes, liver function with a normal. Arterial blood gases is not good. You can concentrate on it, write your impression. pH is low. BCO2 is low. Oxygen is with normal. Oxygen here is measured by kilopascal, and this is a normal range. Bicarbonate is very low. Lactate is 4. Lactate now is important parameter in sepsis of the patient. So it is important to know that it found in all cases nowadays. Lactate now is the indicator for severe sepsis. This is the same arterial blood gases and medication, nothing. Input, output, and this is X-ray of the chest and show something in the right side under the cupula of the diaphragm. Okay, this is the patient ECG. Okay, so what you need to see anything from this, doctor?
No.
Okay, so all right, so we can start. This is the 6, just a minute.
Oh,
Okay. All right, I share again what we supposed to be asked. All right, if you are ready, you can start.
Good evening, Dr. Charlie. I am Dr. Richard,
Yes.
surgical house officer, work in the emergency department.
All
Can
right.
I speak to consultant on call, Mr.
Yes,
Charlie?
I am Mr. Charles. I am the IT registrar. Okay.
I speak to you to inform you about my patient, 73 years old women, have rigid abdominal pain and confusion. I suspect perforated viscous and urgent laparotomy will be required. She is COPD, renal failure on dialysis. BH is and EBG was done, and ECG and chest X-ray. In chest X-ray, there is air under the diaphragm, which is suspected perforation viscous, and with EBG there is.
Okay, so doctor, perforated viscous is a minor case or minor surgery, can even done by laparoscope. So why you need to admit the patient in ICU or ITU?
Because by clinical examination, the abdomen is rigid, and pulse
Yes,
is
I understand that the abdomen is rigid and the patient have perforated viscous, but it is a minor surgery. You just have a hole and you can make suture and put omentum patch. So why you need to admit the patient to ICU?
but her lactate more than 2, it is 4.
She will be improved. The sepsis is improved after evaluation or after put a drain and remove all sepsis. So why you need to admit the patient in the ICU?
There is
So we
decrease
can start from the beginning. What is ICU?
intensive care unit.
So what is the difference? What is the ratio between nurses in ICU and the patient?
1-to-1.
1 to 1. What is HDU or step down unit in Glasgow? What is HDU?
High dependent unit.
Yeah, what is the difference between ICU and HDU?
Nurse to 1 nurse to 2 patients.
2 or 3 patient. Okay. So in general, what is the indication or criteria to admit the patient in ICU or ITU?
Patient need close monitoring,
Okay.
has comorbidity, as uncontrolled hypertension, diabetes, heart problem, need cardiac or respiratory support.
Need
And
ventilator, yes, or organ failure. So just I ask you again. So why you need to admit this patient to ICU?
I think with the decrease CO2 and
No,
pH,
because this patient have comorbidity, because this patient have on dialysis have organ failure and have chronic obstructive airway disease. So this is why, although this is minor surgery or considered as minor surgery, but she is he need to be admitted because they have organ failure. So this is a criteria of ICU. So must have organ failure, need ventilatory support, need close monitor, something like this. Okay, Dr. Osama, you elevate your hand. What you need to ask, Dr.
No, just
Osama?
I need to answer about the questions about the patient's need. Not we can't do laboratory laparoscopic because the patient already is the COPD patient, and the
No,
patient is
sometimes you can do it also. You can do also. It is not wise, but you can do because in the both cases, this patient will have general anesthesia, not regional anesthesia. So in this situation, laparoscopy and open will be the same, so you can do laparoscopy.
yes,
No
and the
problem.
patient post operation maybe need to put the patient still in the ventilator. That's
Can
why we
can
need to
be in
keep it.
ventilator, but the main indication here because this patient is in renal failure, already on dialysis, and
Yes.
so this is main indication.
Uh-huh.
All right, so back to Dr. Muhammad. So can you tell me about the case? You see the arterial blood gases. What is your impression about the arterial blood gases? What's your diagnosis?
respiratory failure type 1.
You mean that it is respiratory acidosis or alkalosis?
pH is low, it is alkalosis, acidosis,
Acidosis. This is acidosis.
respiratory
Okay.
acidosis.
And the BO2 is within normal. Okay. All right. What about the X-ray? What is your impression?
There is air under the frame at the right side.
What it could be due to
Perforation, perforation of
perforated viscous. Okay. What is the common cause of perforated viscous nowadays, especially in older people?
peptic ulcer,
Perforated peptic ulcer due to what?
chronic gastritis.
No, it is just due to medication, usually non-steroid anti-inflammatory. Okay. All right. So after that, what is the ECG finding you see? ECG.
AF, atrial fibrillation.
Atrial fibrillation. Okay. How to treat that?
By decreasing the rate and the rhythm by beta blockers.
Okay.
And
Rate and rhythm, beta blocker, okay, and amiodarone. But in your hospital, they allow you to do that or what?
No, I ask consultation from the ITU registrar or cardiologist.
Okay, so the correct answer first, I will ask the cardiologist if I need to ask you more detail so he can have some medication to control the rhythm and to control the heartbeat, so can be beta blocker or amlodipine. Okay, so but I don't have any empty bed till now. So how to solve this problem?
We can call bed manager for redistribution.
No, bed manager, doctor, bed manager is responsible, is not a doctor. Bed manager is responsible for the bed, but not for the ITU. And you have 9 cases, as you mentioned before, you have 9 cases or 5 cases in surgery in ITU. ITU is trauma. So the mainly it is your case. So any suggestion from your side? You have 5 cases in ITU or ICU.
Can we
Any suggestion from your side?
in HDU we can
No, doctor. Okay, we start one by one. This is ITU is trauma center. Trauma center is mainly surgical case. Okay.
okay.
So the trauma registrar is some now specialized. It is like what is called intensive care or specialty for intensive care. Bed manager is not a doctor, so bed manager have no role. He don't know what is case can be transferred to the ward or HDU and what cases we can transfer to other area. So who can transfer the cases?
Trauma registrar.
No, I mean that what is your role? You suppose you are from the department, so you need. It is your job now to go to the case to see the cases, the 5 cases. If you found some cases is stable, you can transfer it to HDU or to the ward. You
Yes.
understand this point because it's very important.
Yes.
Okay, so it is very important, you know that because most of the doctors in exam speak about bed manager. Bed manager don't know this is stable case or not a stable case. But what we will do as a doctor in surgery, so this is case is related to surgery. Maybe other cases is cardiothoracic, not related to surgery, is not your job, but you know your cases. You know which one is can be stable, can be transferred to HDU, can be transferred to the ward. Okay, so at the end, what else you need to tell me?
Yes, I will review our surgical patient and you need to see which one can transfer to the ward. So we will have a place our case.
Okay, so at the end you summarize. So of course I have this patient with perforated viscous, and although this is minor operation, but this patient have comorbidity in the form of obstructed airway disease and renal failure on dialysis. So I will check our cases, the 5 cases in the unit. If I found any suitable case can be transferred to HDU or even the ward, I will do that. Thank you so much. All right.
Thank you.
So again, what you see in this scenario, we ask you what is ICU, which is 1-to-1, what is HDU. HDU in Scotland, they call it a step-down unit. So HDU is 1 nurse to 2 or 3 or sometimes 4 patients. And after that, the indication is ICU, patient need ventilator, patient have organ failure, patient need close monitoring. Okay, so the solution for that, and he show you the arterial blood gases, he show you the air under diaphragm for perforated viscous, he show you the ECG, and after that I will check the case and try to transfer one of the case and thank him. Don't forget at the end to summarize the case. Don't forget to thank after you finish the call to thank him. Okay. This is easy. Any question? Anyone have a question? The next case, which is common, is the vascular consultant. You speak to vascular consultant. Anyone need to share? Dr. Muhammad Abu Zahra. Okay. Oh, Mahmoud Abu Zahra. Okay, sorry for them. You can see the screen now.
Yes.
Okay, so it is referral to vascular department. You are Dr. Richard again, SHO for Mr. Morrison. You will call to Mr. Arthur, is a vascular consultant in charge. We don't say it is in other hospital, so it will be the same hospital. Today you tell him about a case of lower limb ischemia. 75 years old, chronic smoker, admit with abdominal pain, diagnosed as diverticulitis, relieved by medical treatment. Now he is complaining of sudden acute lower limb pain with a history of pain where he's walking, improved when he stopped 5 minutes. He is hypertensive on Brendopil. Brendopil is Coversil, is AC inhibitor, and has history of atrial fibrillation, but it is not in any treatment now. Vital signs are normal, except pulse is 100 and irregular. Chest, heart are normal. Abdomen is lax. On examination, the left leg cold, loss of hair, decreased sensation, reduced motor power, and peripheral pulsation are weak. This is what is written by Houseman, so it is the same, but written handwriting like 75, chronic smoker, admit abdominal pain, diagnosed as colonic diverticulitis, relieved by medical treatment. Now he is complaining of sudden acute left lower pain. The pain increased by walking, improved by stopping 5 minutes. Cramping in nature, not radiated. Past history, hypertensive Brondopil, Coversil, history of atrial fibrillation. On examination, vital signs, the pulse 100 irregular, blood pressure 140/80, chest normal, heart normal, but irregular heartbeat, abdomen is lax. Vascular examination done, right lower limb is normal, left is cold, loss of hair, decrease in sensation, decrease in motor power, weak dorsalis pedis, and the posterior tibial pulsation. Investigation, you can see here the white blood cell is very high, 26.
Okay.
Hemoglobin 13. Renal parameters is okay, except this is plasma potassium is low. Lipid profile, I think, is okay. Serum lactate, and now again, serum lactate usually in the all cases we put it is 2. 2 is within normal. Arterial blood gases pH 7.2, BO2 within normal, BCO2 low, bicarbonate 15 low, and this is again ECG.
Okay.
This is the angio.
Okay.
Okay. So I close this. I have the same in the slides. So I have another slides. I have presentation. This is very common scenario and have a lot of question. I share the screen again and you can start when you are ready.
Okay. Okay.
Yes. Hello.
I'm Dr. Richard, the CTO, working for Mr. Mann in emergency department in St. Vincent Hospital. Could I confirm
Okay.
that I'm to vascular consultant?
Yes, I am. I am Dr. Arthur. Okay.
Today I have a case who has diagnosed with acute colonic diverticulitis, and but now she has absent pulse in his leg, and
Which leg?
I think the left leg.
Left leg. Okay. So what's your diagnosis?
I think that is maybe acute limb ischemia.
Maybe, or are you sure?
Till now, the clinical signs suppose it
No,
mostly.
no. Are you sure it is left lower limb ischemia or not? Don't be hesitant. Are you sure or not?
No, as there is no investigation done to confirm that.
No, we have investigation. You have angio, doctor. Relax.
Yes. Okay.
Are you sure?
Yes.
Okay, so why you are sure?
Because the CT angio
No,
showed that.
doctor, relax. When you ask about presentation, you start by clinical. So clinically, patient have pain. By physical examination, the pulsation is weak, motor power is decreased, sensation is decreased, the limb is pale and cold. This is all data is written in the script, and you have the script in front of you in the first room, preparation room, and also in the second room, and the examiner call you in the telephone, he don't see what you are doing. So you can open and read.
Okay.
Okay, so start again. So you have left lower limb ischemia, and you are sure because the patient clinically what he had.
He has pallor pain, decreased pulsation, decreased sensation also, and also his leg was cold. And
Okay,
the
so what is this ischemia in this patient? What it could be? Give me 3 possibility to be the cause.
Okay, it may be due to the ECG show it may be embolus.
So first can be embolus because ECG. Second,
it may be due to stasis or
why?
dehydration.
Dehydration. Why?
The patient he has admitted and he has
it is correct because this patient has diverticulitis, so they have diarrhea. So they have
yes.
this bloody diarrhea, so he's become dehydrated, so can be hypercoagulability due to dehydration.
Yes.
What is the third possibility? The patient, how old is the patient? It
The
is in
old age.
front of you. Okay.
Old age.
So can be atherosclerosis. So in this
Yes.
patient, you have 3 possibility. This is can be embolus because the patient have atrial fibrillation. This is a patient can have thrombus due to atherosclerosis and old age, is 75. This patient can have dehydration and stasis due to diverticulitis, so can cause hypercoagulability state. This is why we mentioned this patient has diverticulitis. Okay?
Yes.
All right, so come to the next question. So is this leg is still viable?
The patient has some sensation and he can do some movement. It may be it will be yes.
Yes, so it is still viable. It's not for amputation. Okay, so this patient is fit for transfer or not?
I think the patient is fit as his vitals are okay except the pulse
Okay.
and
So when you transfer the patient in ambulance, what you give him in ambulance?
okay, I will consider giving him oxygen and the ambulance will be prepared with CPR and amiodarone.
Okay. All right. So in the ambulance, you give him oxygen, you
Yes.
give fluid and analgesia, and you transfer him with a doctor. Of course,
Okay.
all ambulance, most of the ambulance is have CPR and ECG. Okay. How urgent you transfer the patient?
Okay, I will transfer him immediately as the patient may cause amputation. This is
No,
immediate.
no need amputation. So you transfer him immediately. So you need me to go to hospital today, or I see the patient tomorrow?
No, right now.
Right now. Okay. If this patient have ischemic bowel,
He may, according to the AF and all the presentation with the patient, he may have mesenteric ischemia. Yes.
okay. So if you tell that to the examiner, what you expect is the examiner tell you. Suppose you are speak to consultant in your hospital, and you
Treat
tell
him
him this patient have mesenteric vascular occlusion. Is mesenteric vascular occlusion is treated by vascular or by general surgeon?
general.
Okay, so what you the examiner tell you, okay, can you sort it out first, mesenteric vascular occlusion, and after you sort it, you can send the patient to me, and he puts the form.
Yes.
Okay, so you are be in critical situation, and this has happened many times. Okay, I have this station in India last 2 months ago, and all the students say this patient have mesenteric vascular occlusion. So it is wrong. It is not mesenteric vascular occlusion. So why you say it is mesenteric vascular occlusion? Because the AF.
Yes, and
So why the patient don't have a stroke or heart or ischemic heart? Can also happen.
yes.
So it is difficult to have two pathologies. So don't be so clever.
Okay.
You understand the idea?
Yes.
Okay, this patient never have mesenteric vascular occlusion, because if you are query mesenteric vascular occlusion, you don't transfer. The problem now is the lower limb. Osama, you need to speak about this point. I think you have it in the exam.
Yes, I need to speak about this.
mesenteric
this
vascular or ischemia.
نو اتس اسكيميا. هي لو كانت ميزنتريك اسكيميا كان السيناريو كله حيكون يعني متغير تماما، ومش حيكون
تمام.
في ترانسفير. هو حيبوش يو يعني حيجبرك. هو من غير اي شيء حيقعد يجبرك ويقول لك طيب اوكي خليه عندك لحد ما تعالج الاتريال
اوكي
فيبريليشن. اوكي لو هو لقط منك بس كلمه ميزنتريك اسكيميا حيقول لك لا ده الباول اهم وممكن يخش في بروتينايتس وانت اعمل له عمليه الباول وبعد كده انا حاجه يعمل له او عمل لي ترانسفير.
اوكي، اوعى تكون انت اللي قفل في وشك السكه، ولا مش انت يا
لا
اسامه؟
لا 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 مش
طيب.
انا، لا مش انا
هي
لا.
alright.
عموما
اوكي.
كانت لجنتي برضه، بس هنخلص واقول الاسئله اللي اتسالت لي ان شاء الله.
alright. اوكي.
تمام.
اوكي. So are you sure this patient have ischemic bowel?
Not likely.
Okay, is abdominal ultrasound is help to diagnose mesenteric vascular occlusion?
No, not good.
Okay, not accurate. All right. Okay, what is the effect of gastrointestinal diverticulitis in this blood electrolyte?
Okay, the diverticulitis will cause diarrhea, which may cause hypokalemia for the patient.
Yeah, if you remember the data, because I don't found a copy from it, it is 2 point something, so it is very low. All right. Next question. Is this patient have sepsis? Severe sepsis?
Okay, according to the files I have, he has no sepsis because lactate level is within normal.
Okay, so now nowadays lactate is usually main indicator of sepsis. We don't use it in past, but now use. What is ECG abnormality you see?
The patient has absent B wave. I think this is AF and
Atrial
also
fibrillation, not absent. It is multiple small A wave, so or cannon shape, so it is atrial fibrillation.
yes.
Maybe some ventricular ectopic, but it is mainly atrial fibrillation. How to treat it?
Okay, I will ask a consultant from cardiologist.
No need for consultant. I consult a cardiologist. مش لازم يبقى consultant. Anyone from cardiology department. Okay, and usually he give beta blocker to reduce the rate and amiodarone to anti-arrhythmic. So don't forget to ask the help. Don't be a hero.
Yes.
Okay, what type of pain in this patient? We mentioned this pain is intermittent and he stopped 5 minutes. What we called it?
Claudication, intermittent claudication.
Intermittent claudication. Okay. All right. You see the arterial blood gases. What is look like?
Acidosis.
Which type of acidosis?
Metabolic.
Metabolic acidosis. Are you sure? Yes.
Yes.
Yes. Okay. What is the effect of hypokalemia in ECG?
Okay, hypokalemia. Hypokalemia. Okay. Hypokalemia. No B, absent B, or no B, absent B. It may be present U wave. Prolonged QT also.
Okay. See, it is mimic ischemic heart, I think. All right. How to manage this patient?
Okay, I will start treating this patient according to care of critically ill surgical patient.
Why you consider this patient as critical ill patient?
Because he is post-operative patient.
Post-operative, not critical patient. Post-operative is post-operative. Critical patient must have organ failure or many organ failure. It's not critical ill patient. It is just a normal patient.
Okay.
Okay. So
okay.
how to manage?
I will start stabilizing the patient, giving him IV fluid, and I will.
Before IV fluid, why this patient come to you?
Okay. Sorry.
Why is this patient come to you?
Because he has diverticulitis.
No. Apart from diverticulitis, now we speak about lower limb. What is the problem in the lower limb?
Absent pulsation.
I know. But what is the patient complain in lower limb?
Ischemia.
Pain. So
Pain.
how to manage? What you give him? The first one you can see?
Yes, analgesic.
Analgesic. So if your patient come to you with pain, you must give analgesic. So analgesic. What else you need to give to him?
I will treat, stabilize the patient, correction of hypokalemia,
Okay.
correction of the anticoagulation,
What
treatment,
you give for anticoagulant?
unfractionated heparin. I will start with,
Low molecular weight heparin. Okay. Okay. What else?
I
You need to
will,
correct metabolic alkalosis. You need to consult cardiology for treatment or plan for AF. Okay. So what you expected I do for this patient? What shall I do for this patient as a vascular surgeon? You
angioplasty.
okay. What you mean by angioplasty?
Okay. What?
What you mean by angioplasty? I don't understand you. Is means that what you mean in medical term like angioplasty. So what shall I do? Is this
Okay.
patient come to my unit? So what shall I do to him? You can see the angio. You see the angio.
Yes.
Okay, what you see in the angio?
Absent. There is embolus or absent shadow of the vessel.
Which vessels?
The left. This is uh,
The end
femoral.
of femoral and the beginning of popliteal.
Yes.
So what you in this picture? What is the explanation? This patient not in bad condition and do not need amputation. What is the cause of that?
Maybe collaterals.
Maybe or the collateral is good. You can see the collateral. You can see the lower is blood flow is good.
Yes.
Okay, this is good sign. But what we will do for this area, for this embolus in the end of femoral or beginning of popliteal, what shall I do?
I think, as I know, it's angioplasty. That's I know.
You mean what is the cause of obstruction here? Can be embolus or thrombus. So shall I remove it or not?
Okay, mostly here due to AF, so it's
No.
embolus.
Yes, but what I do for embolus? I remove the embolus.
Thrombolysis.
No, remove the embolus is embolectomy. Followed
Yes.
by if it is a stricture, I do balloon dilatation.
Yes.
If it is still not good, I put a stent.
Okay.
Okay, I think angioplasty, you mean that balloon dilatation? I think so. All right. So investigation, your diagnosis, angio. All right. Okay. Okay. So at the end, can you summarize?
Okay. Mrs.
It is important, by the way, usually the examiner don't ask you to summarize, but you need to summarize. Okay,
Yes.
go on.
I have a patient who's diagnosed with diverticulitis. Now he has absent pulse and pallor, and
In the left leg.
on the left leg. I want to refer him for definitive treatment, as he, I think he was for the vascular consultant to for the definitive treatment.
For revascularization or for embolectomy and revascularization for this left lower limb to save the limb.
Okay.
Okay. All right. So we start from the end. If you have
Yes.
this station in exam, you thank the examiner at the end and summarize or not summarize.
Yes.
You summarize to him.
Yes.
Okay. After that, what is the problem you face in this station?
انا نتكلم في العموم يعني.
اتكلم في العموم.
طيب انا جالي اول حاجه هو سالني، انا اول مره اشوف فايل وانا ساعه لما دخلت الامتحان فاجئت من حجمه اصلا يعني.
تمام.
طبعا كان قدامي كل الحاجات دي مش عارف اعمل ايه.
ما
قعدت
هو
كام دقيقه.
انت بص، انت لما تشوف الفايل كبير انت هتبص على الانفستيجيشن. انت عندك فيكسد انفستيجيشن arterial blood gases ECG and blood picture. Blood
Yes.
picture faster, just looking for leukocytosis, looking for hemoglobin, looking for potassium, looking for renal function. After that, go to the blood gases, go to ECG.
Yes.
This is important. And don't forget nowadays lactate. So you notice lactate or not?
Yes.
Notice lactates. When he asks you about sepsis, what is your answer?
هو اول ما بدأ معايا قال لي
Yes.
what did the patient take when he managed for the first time. خد
Okay.
مورفين. he took morphine.
Okay. Okay.
قاعد
Analgesic.
يس قاعد يسأل بقى شوية أسئلة تفاصيل جوه الورق نفسه.
Like
يعني
what?
عامل ايه الانستيزيا بتاعته كان فيها ايه هي الباك جراوند بتاع البيشنت. قاعد يسألني في الورق نفسه. وبعد كده دخل بقى هو I want you to transfer the patient. طبعا بقى قلت له البلسلس والبالور والحاجات دي كلها. بعد كده how will you transfer the patient, what is the type of the ambulance. It's
Yes.
blue
type of ambulance, by the way, it is blue. You know, in the Egypt or any country, you have two type of the car ambulance. One is the red lamp and one is the blue lamp. You know that?
yes.
Blue lamp usually have CPR and have a cardiac monitor or have a facility to transport the patient with cardiac problem. Red one is just transport any patient. Can be orthopedic or other. So we called it blue code, or we called it blue code level 1 or urgent ambulance. After that, what he asked about.
Okay. سألني what can you do لغاية لما تنقله. يعني كان عايز فاشيوتومي.
لا هو مش عايز. ما فيش في السؤال فاشيوتومي خالص يا راجل. هو this is the answer of this question. What you will do, it is two part. What you will do during transport, it's as I mentioned to you. I give intravenous fluid, I give analgesic, I give intravenous fluid, analgesic, and oxygen. Before that اللي هي الكونسلت كارديولوجي، اورال انتيكواجلانت، correct metabolic acidosis and correct hypokalemia. No fasciotomy. You don't do fasciotomy. He will be the surgeon, not you.
هي غلط ما انا عارف.
No fasciotomy. He can do it later, but it is nowadays everything done by intervention radiology, so we don't need fasciotomy. What else he ask you?
مانجمنت بتاع الهايبوكاليميا هو إذا patient has hypokalemia الأول. هو إذا patient has hypokalemia.
So why he have hypokalemia?
Because the diverticulitis which may cause dehydration for him.
بلاش حكاية may be, because diverticulitis, you know that any secretion in GIT secretion like severe vomiting, severe diarrhea, we have loss of potassium.
Yes.
Okay.
Hypokalemia, management of hypokalemia, management of AF, and type of
what is your answer in management of AF?
طبعا قلت الريت كنترول والريزم كنترول والانتي.
What is his response?
ما كانش عاجبه.
Okay, so suppose you are in England or in Egypt, in your country. So if this is the nurses, suppose the nurses, if you write this is medication like beta blocker and amidronol, and you are not cardiologist, is the nurses follow your what you're written or not?
No.
Okay, so don't follow you. This is why the correct answer is just to consult the cardiologist. Okay. I examine about 200, maybe 400 in India for the same station, and all they have this. This is in most country. You can treat diabetes, you can treat sometimes hypertension, but in consider the cardiology, usually cardiology is a sensitive area, because if you give something high dose or low dose, maybe the patient is dangerous. So they don't allow you to treat cardiac patient, like not cardiac from surgical point of view, like from cardiac point of view. Because you know you need يعني الدوز, الروتس, many medication. It is not like antibiotics. Sometimes you have few antibiotics. So this is why it is not good answer if you say I will do that or do that, because it is not your specialty. Okay.
معنى كده يا دكتور بعد اذنك انا هقول له هانفورم الكارديولوجيست وابدا له اقول له على العلاج يعني في نفس الوقت.
Yes, sometimes he can ask what you give to him, so just rate control and rhythm control, but actually in the ideal answer it's just contact cardiologist.
وفي انا في الاكزام بتاعي قال لي كلمه واحده. هو زي ما قلت لحضرتك ان الاسئله بيحاولوا يغيروا فيها في شويه تفاصيل. انا لما وصلت معاه لحد ان هو البيشنت نيد ترانسفير، فقال لي هو before the transfer what you will do for this patient، فهاو تو مانج او what's the plan for you. فانا قلت له زي ما قلت حضرتك يعني treat the correct metabolic acidosis.
نو انت كوريكت ده يا دكتور اسامه is done in the hospital not in the ambulance. انت مش هتعالج العيان في الامبولانس.
بالضبط. هو كان عايز
هو it is important to know main indication to transport the patient must be stable. To be stable, you must control potassium, you must control metabolic acidosis, you give oxygen, you start oral anticoagulant or Clexane or heparin or whatever. So you need to stabilize the patient and transfer him because most probably he's become urgent operation. So he don't need to waste time to control the patient metabolic acidosis and potassium, and it is easy to be done in your hospital. And usually it is in the same hospital, so it is better also to, in sometimes, but not in this case, just we prepare the theater for you or all this. Okay, so I think he need to just during transport, oxygen, intravenous fluid, and analgesia. Most of the students forget analgesia. Okay, Osama, back again. All right. All right,
No.
Dr. Osama. So again, it is just stabilize the patient and just in the ambulance, oxygen, analgesic, and intravenous fluid. Dr. Muhammad, what you need to ask to tell?
هو عفوا دكتور، هو كان عايز ايضا ان اقول له على كلمه ان ادي له 5000 انترناشونال انفراكشنيتد هيبارين. هو كان عايز لازم انك انت تدي له الهيبارين وانت رايح له في الطريق.
هو انت already start anticoagulant whatever injection or oral before transporting.
يعني يا دكتور الحاجات اللي فيها تفاصيل طويله، يعني اللي بتاخر البيشنت عندي في الهوسبيتال، يعني مثلا زي كوركت اللاتريال فيبريليشن اند كوركت الميتابوليك اسيدوز الهايبوكاليميا، مش لازم اقولها، يعني اقول له فقط stabilize البيشنت اي في فلويد اكسجين انالجيزيا.
No. Because this is a question or in the real scenario is two parts. First, how to transfer. I just bring it again. How to do during transport oxygen intravenous analgesic. But how to treat the patient, it is before. Treat the patient before transport اللي هي هجيبها لك تاني، اللي هي الانالجيسيك، اللي هي دي analgesic correct. All this is done in your hospital before transfer. You see the screen or I don't share? Analgesic, correct hypokalemic, treat AF by cardiologist, anticoagulant. ممكن تعمل اي ان ار لو هو كان بياخد اورال انتيكواجلانت قبل كده. كوريكت ميتابوليك اسيدوزس. انت ستابلايز ذا بيشن عندك اند ترانسفير هيم. دكتور محمود، انت كنت عايز تسال تقول ايه؟ قال لك ايه تاني؟
هو في سؤال واحد قال لي اما قلت له، قال لي ايه التشخيص المبدئي للديفرتيكولايتس؟ كود ات بي ميزنتريك اسكيميا. المهم قعدت اقول الاجابه اللي هي محفوظه في الكتب، فور ناوز ابدومن السوفت اند كذا الحاجات دي كلها. قال لي tell me likely or less likely.
It is less likely because I tell you, Dr. Mahmoud, because we have this is scenario we repeated thousands of times. And most of the students speak about mesenteric vascular occlusion. Mesenteric vascular occlusion, if happened, you remove from duodenum to ileum, you remove a lot of intestine. This is the surgical job. لو انت transfer this patient to vascular unit, this patient will die for mesenteric vascular occlusion. So you are sure it is not mesenteric vascular occlusion.
Yes. انا فاهم، بس انا بقول الاسئله.
انت دكتور محمد، انت اجاباتك كلها انت لازم تبقى شور. يعني مثلا لما انا قلت لك في الاول are you sure this patient have ischemia؟ yes. لان انت لو قلت لي I am not sure هقول لك خلاص، ما هتحوله ليه؟
yes.
ما انت وانس ان انت رفعت التليفون عشان تكلمني يبقى you consult your senior, you consult someone, you are sure this is a vascular problem. لكن الايكويفوكال او الاجابات اللي هي يعني المايعه دي ما تمشيش معانا. تمام. ماشي. برضو انت
ماشي.
محتاج شويه ثقه، محتاج تشوف انت، يعني ربنا يسهل ان شاء الله، بسيطه يعني.
الله.
تمام.
شكرا.
هي دي كده. انا كل الفون كول انا هبتدي معاكم الانفورميشن جيفنج usually how to manage the patient, and usually the patient is angry. We still till now we have a problem for the some or all the doctor. This is why we have this problem. If the patient is still standing, you're still standing. Okay. I will start by this famous case, splenectomy in the child. So we just ask, is any volunteer? Osama is not here, so any volunteer? Okay, Dr. Osama again. Any volunteer to answer this?
أنا ممكن.
Okay, you can start again. All right, you need to be don't shy. Splenectomy in child is very common scenario. If the scenario is very common, it means that till now no one answered it correctly, or the student still failed on it. So Smith, 9 years old boy. So this is the name of boy. Injured in the park. Park mean gardening. Admitted for splenectomy. And the consent was signed by his father. His mother is angry. At the time, the child in the theater. So the child now in the theater. Both parents are separated or divorced. Child father is alcoholic. Alcoholic mean drink alcohol. Patient hemoglobin dropped from 9 to 8. Abdomen is rigid. Has fracture lower limb side ribs. Fracture in the lower left sided ribs, usually 9, 10, 11. Situation was explained to his father. He signed the consent. The consent was taken by another doctor, not you. And you made the patient mother in emergency department. So just read it again, and I start with you again. Just read it, put your notes, you can find what happened. When you're ready, tell me.
Ready, Bismillah.
Okay. All right. So usually when you enter, the patient is standing and shouting to you, where is my baby? Where is Smith? He's shouting, he's standing. He's not sit down. So what you supposed to tell her? Where is my baby? Take me to my baby. Take me to Smith. What shall you do?
I am Dr. Muhammad, one of surgical doctor. Your
Okay.
child get a room because he reaches the hospital with some sort
Where is
of
my child? The patient shouting you. The patient is still standing.
in the theater.
Okay, so you need to confirm here in the theater. So, and can I go to see him in theater?
No, he is now in theater and
Not allowed to enter. So the first thing you need to do, because this is even the last exam, they have this problem. The patient is standing, you're still standing. Don't sit down. Don't say what you know about his case. Just say here, he's in theater now, he's in operation now. Is not allowed to enter the theater. So can sit down, and I explain to you the situation. In this situation, the patient sit down. If you don't do that and start by what you know about your case, can I confirm that you are the child mother? Can show me ID? I don't speak to you except you are sitting. This is very frequent habit in exam, and it is not logic. Okay, so your child is in theater, not allowed to go, can sit down. I explain to you the situation. Okay, so I will ask you in behalf of the patient mother, what is the operation, doctor?
The operation is exploration of the spleen, and the surgeon will try to save the spleen and stop bleeding. But if
In your life, doctor, you see any surgeon save the spleen?
no.
Okay, so what is your answer now? Correct your answer. So what is the operation? The operation is removal of spleen.
The spleen.
That's it. What happened to my baby? What happened?
Your baby is falling down, and there is fracture of his lower left ribs, which injured his spleen.
Okay, so who signs the consent?
His father.
So why you don't wait me till I can sign the consent?
This is emergency case, and we cannot still till you arrive and should reach the theater to save his life.
This is not the correct answer also. What is the correct answer? Anyone know what is the correct answer? Why you don't wait me?
His father consent is
No, why you don't wait me? Osama, I think he answered. What is Osama? What you need to say?
Yes, because your child is harmed himself from claim and urgent condition, and we can't still wait you because they may be effect of your life child.
Okay, so Dr. Osama, you mean that his father's signature you are needed or not? Actually, you need it or not?
No, it's
No
not
need.
needed.
So again, the answer is this is condition. Suppose his father is not with him. You send the patient to theater or not, Dr. Muhammad?
Yes.
Mahmoud. Okay. So in this situation, whatever the mother, the father, no one, even this patient come by ambulance, no one, we need to operate it. So who signs the consent to his father? Why you don't ask me to consent? First, because his father no. Second, in this emergency situation, we don't need signature of anyone, just we can have signature of two consultants. Okay, you understand this point?
Yes.
Okay, so who did the operation? Mr. Wolverson or whatever. It is expert in this operation.
Is expert in this operation.
What is spleen? You say remove the spleen. What is spleen?
The spleen is an organ at the left side of our tummy. And
okay. What is tummy mean? Abdomen. You mean abdomen. Okay. So you can draw, but simple like this. So it is in the left side. All right. Okay. So what is the function of this spleen?
Give immunity against infection and bacteria.
Okay. Yeah. All right. So how did you know the spleen is injured?
There is some ecchymosis at the left side.
So you mean clinical, you have ecchymosis and rigid abdomen and
doing fast scans.
Before fast scan, the hemoglobin drops, so it has been hemorrhage, and to confirm it by what does fast scan mean?
Focal assessment sonography of trauma.
Okay, all right. So they can found free fluid. Of course, to confirm this is not the patient, this is the examiner now. How to confirm the grading for splenic injury? We have 5 grading for splenic injury. How to confirm it?
By CT.
By CT. Which grade of the splenic injury you need to remove? You must remove the spleen.
4 and 5.
4 and 5. Okay. So back again. So you know that clinically by rigid abdomen, drop hemoglobin, radiologically by fast scan, okay, or ultrasound. So what happened if not removed?
Maybe
not maybe, doctor. What happened if I don't agree or you don't remove the spleen?
Bleeding will endanger his life.
What you mean endanger? He can die.
He can die.
Okay. All right. So what happened? All right. So all right. Before that, just what you know to remove the spleen. Okay. What happened if not remove? Okay. Why you can't remove damaged part only and stop bleeding?
We
can you just remove part of the spleen and leave the others?
No, should be removed completely.
Okay, so some centers they try to do that, but it is not common policy. So usually we remove it completely. You know that even in Egypt they start partial splenectomy maybe 20, 30 years ago by Dr. Rifat Kamel, but it's still not popular. Okay, all right. So after that, what happened without spleen? Is become handicap? Is something like that?
It become normal.
Normal. So he can go to school. He can practice exercise.
Yes.
Are you sure? Okay. Is any long-term effect?
No, I should have vaccination.
Vaccination against what, doctor?
Pneumococcal, meningococcal, and Haemophilus influenza.
Okay, so long vaccination or give vaccination. Okay, can take antibiotic or not?
Just prophylaxis dose.
All right, this is correct. So don't say long life or all this. This is the old policy. Prophylaxis means 3 doses or others. Okay, is any alternative? Don't remove the spleen.
No.
Okay, just tell me, doctor, is his father drinking at time of the consent?
Of course not.
Why?
We just have a consent from person have a
But
capacity.
you don't take the consent. It's taken by Dr. John, not you. So are you sure he's not drinking?
I sure the policy here is taking the consent from the patient have from the parent have the capacity which understand and give a response to the information.
Okay, so this is a correct answer because many of the students in exam say, I don't know because I don't take the consent. It is done by my friend. I will ask him. So this is not a correct answer. Whatever, who takes the consent, if once the patient signs the consent, it means that have capacity to sign. So it is completely conscious. Okay. So you know that I have a problem with his father and they have divorced and all this. So can you help me in that?
We should share this information with social
Social
consultant.
service. Okay. All right. That's don't go to in much detail. It is not your job. All right. I just tell you the mistakes. So the mistakes is usually about the consent. And it is important to know the consent in the splenectomy. Suppose this patient have rupture aortic aneurysm or trauma or some whatever, we don't wait the family. We can explain to the family, but actually they don't need to sign the consent. So whatever his father, mother, even both is not present is not a matter. Okay, again, we give antibiotic prophylaxis like any operation. We don't give it 9 months. We don't give forever. We don't give at the age of 25. It is very, very, very old policy. We just give the patient vaccine. Sometimes maybe have booster dose. That's it. After that, you need to summarize. So can summarize.
Okay, your child reaches the hospital with injury to his spleen after fracture lower left ribs and dropping of hemoglobin, which indicate bleeding and rigid abdomen, and after sonography, which confirm the condition, he go to the theater and our surgical consultant, operating him now to stop bleeding and remove the spleen.
Okay, so the scenario is easy. So don't say we will try to save the spleen because you make the decision to open. So you don't see anyone open for splenectomy and after that close and say we save the spleen. It is not liver tear, you can ligate it or suture. All right.
هو
I
ممكن
think
بالنسبه للفاكسينيشن هل ممكن يسال على التايم اوف فاكسينيشن يعني امتى ندي الفاكسينيشن او
لا انت اللي هتقول لي what is the time we give vaccination.
اللي انا اعرفه 2 weeks before
طب
elective
2 weeks before ازاي وانت هتعرف what you expected this patient have accident after 2 weeks.
for elective or
Doctor, we don't give option. The answer is when the vaccine is available, we give it to him. Because this is not elective. In elective, okay, we can give it 2 weeks before, but this is not elective. So we're looking for the vaccine. If it's available now, we give to him. So when the vaccination available, we give to him.
after operation after splenectomy.
طبعا في يوميها لو عندك بعديم العمليات بس.
تمام. والبروفلاكتيك antibiotic
in any operation, what is your policy to prophylaxis antibiotic?
1 dose with induction and 2 doses for 48 hours.
طيب ما هتقول كده يعني انت ليه عايز تغير سياستك يعني؟ يعني هي زي ما انت بتعمل بنعمل. الموضوع سهل يعني.
تمام.
يعني don't be so clever, don't say something strange, don't say something illogic. Everything is easy.
Yes.
Okay, what you do in your country or Egypt or your hospital, this is what we will do. If you go to extreme, usually it is easy way to fail. If you say something funny, something strange, we try to save the spleen. We try to make, okay, in some countries you can have mesh to protect the spleen, but once you decided this is for splenectomy, I think it means that it is grade 4 and 5, so it is must be removed. Okay. And again, we don't need a consent. So if the mother is angry, not angry is not our job. All right.
All right.
Okay. This is common splenectomy or angry mother is very common scenario and very repeated many times. I think they repeated maybe 1,000 times or something like that. Okay. If you see usually in the record, you can find this is very common. It means that the student is not expert or don't tell others. So who else not share? So we can take the other one is a common is malignant ascites. Who need to start? Anyone? Okay. Dr. Abu Zahra, Mahmoud Abu Zahr. So I share the screen. So Dr. Mahmoud, you can see now. I read it. So okay. So okay, Mr. Gray wife came today. Of course, she is angry to meet the consultant, Mr. Man. By the way, Mr. Man or Man is not not a name. It is just a common exam. I don't know why. To discuss her husband's case diagnosed as malignant ascites. The patient just admit 2 days ago. 2 days ago. Only done in basic blood investigation and aspirated cytology or fine needle aspirated cytology from acetic fluid. He's non-smoker, drink alcohol occasionally. One of the staff told him yesterday that he had advanced cancer, incurable, in the late stage. So the patient is sad. CT is not working today. Will be take few days, maybe weeks to be fixed. The word broken CT mean not damage, it's just not working. The patient brother live in Australia. He just have coronary bypass few months ago. You are CT. CT is core training like SHO or internship in other country. You are junior doctor. Came in behalf of the consultant as he have emergency operation, which is abdominal aortic aneurysm injury. Rupture or impending rupture of aortic aneurysm. Okay.
Okay.
So you can start, just read it clearly and we can start.
Okay, we can start.
Okay, so you can start first. So the patient is angry, patient wife is angry. You come to her, you can start.
Okay. Hello, I'm Dr. Mahmoud, one of surgical doctor.
Okay.
Could I that you are Mr. Green wife?
Yes, but I don't wait you. I wait Dr. Mann. Where is Dr. Mann?
Okay, Mr. Mann is now is an emergency room, and I am here to speak to you about your.
My case is also emergency. My husband, they have critical situation. He have problem in breathing. So why he's not come? I am so sad because he's not coming.
I'm so sorry for that. All
This case is important than my husband case.
Okay, let me explain for you. Your case, your husband case is
No. I just ask you. Okay. Is the cases with Mr. Mann now is important than my case?
No. All cases are important, but
so why he left me? What is the emergency in this case?
Okay, the emergency is this patient has this patient has emergency operation, which is called a abdominal aortic aneurysm, which means there is a large vessel in the tummy which may rupture in any time and cause.
So just to make it simple, this patient who is operated now, he have injury of big artery called aorta, and this is life-saving, and he can die if we don't save him. Okay?
Okay.
So this is the explanation. All right. So, are you sure my husband have advanced cancer?
Yes, we are sure.
So how we are sure is only one test done, which is fine needle aspirated cytology.
Okay, the
Are
fine
you
needle
sure?
yes. The fine needle aspiration cytology is an accurate test with 100%. It show malignant cells in your tummy, in your
Any
husband
error
tummy.
in this cytology, can we repeat it?
No, it's diagnostic. It's
Where
100.
this cancer come from?
Till now we are not sure, so we ordered CT and to know the origin of the tumor and of the cancer and all details about it. We can know
But your friend tell him he's advanced cancer. It is
yes,
true or not? How he
yes.
knows that it is advanced?
Okay, because presence of this malignant cell or cancer cell in the tummy present that is that the tumor has spread for a second place or
Okay,
distant.
so you mean that this is metastasis, so means that it is advanced case. Yes, it is not a primary tumor in his abdomen, so this is malignant ascites, means that this is secondary to the tumor. So it is the late sign of cancer. Okay?
Yes,
So are you sure that is not definite surgery or definite cure?
yes, there is no definite surgery or no. The tumor is not cure. I'm so sorry
So
to tell.
is any surgery can be done?
The surgery here has low benefits and more pain and it is and no surgery will be done here.
Okay, so who will treat him if it is not surgery?
Okay, we will there will be a team of multidisciplinary team, which is a team of radiology and oncology, which will decide the plan of the management of your husband.
You mean that is the main team is which specialty? I don't understand you.
Okay, it's sorry.
I don't understand what you mean by multiple disciplinary. What is the main, what's the main specialty of the main part of this team?
It's oncology. The main
Oncology.
one is
So you need to tell her it is an oncology department or chemotherapy. All right.
yes.
So, but you don't know the tumor. How to treat him? We don't know the tumor.
Because we have definitive management. It's a cancer and will not treated by surgery as it is
It's
distributed.
advanced.
Yes.
Okay. All right. So, but you say, I hear that the CT is not working. So can transfer him to other hospital or do anything instead of this CT.
Okay. I think we can do ultrasound, but this is not needed right now. It will not affect our the management or the prognosis of the
Okay.
tumor.
All right. So his brother in Australia have coronary bypass done 3 months ago. Shall he come to visit him or I don't tell him?
I'm so sorry to hear that. Okay, that's of course you can, as we are sure about the diagnosis, but I think you must take consent from your husband first to
No,
inform us.
consent from husband. No need. He just ask you.
Yes,
He
you
tell
can.
his brother to come or not.
Yes, you can. As family support is encouraged in this.
So why you tell her that she bring his brother?
Uh,
What is what is your idea? It is correct, but what is the idea?
okay, it's family.
No, I
That's
tell you. Suppose this patient have laparoscopic cholecystectomy,
okay.
and she tell you, can I ask his brother to come from Australia? What is your answer?
No.
No need. So why you ask this lady to bring his brother? Because this is
Sage.
a end stage or terminal case who maybe don't see later. You understand the idea?
Yes.
Okay, so first you ask him to bring his brother because this is end stage. This is malignant ascites, mean advanced cancer. It is not important to know the cause. Can be from the liver, can be from ovary in female, can be from stomach, can be from the colon, which is most common. But to know what is the origin is not much significant.
Okay.
You got the idea?
Yes.
All right. So why the student fail in this station? I just wait Osama at the end because I know he knows all the answers. Why the student failed in this station? What is your opinion, Dr. Abu Zahra?
السؤال اللي هو المشهور بتاع is it malignant cancer هيخشوا يقولوا I am not sure. ده أكتر سؤال غلط فيه بيتغلط فيه.
Okay. So if patient have malignant cell under microscope, it is sure. So I don't sure or it is early to discuss that. It is rubbish.
Yes.
Second, it is sure it is a cancer. Second, the big problem, this is why this station is fixed for a long time. Most of the students become obligized. We are a small hospital. We are poor people. This is the only city we have. Something like mercy. This is not like that. If this CT treats the patient, if you know this is from colon or from, for example, ovary in female, it make a difference in treatment?
No.
Make a difference in prognosis?
No.
Okay, so no need to say we can contact other hospital to send to him. We can go to other hospital. We something like that. All this is no need. Osama, what is your comment?
Yes, doctor. My comment about the questions when the patient asked the candidate why this is the small hospital. I need to take my husband away from this site to do another CT. فالكانديديت في هذه اللحظه شو بيقول لها؟ بيقول لها لا اي نو از يو منشن ده هوسبيتال صغير ومش عارف ايه، وانا هعمل لك الترا ساوند وهعمل لك ام ار اي. فزي ما
Okay,
قلت
all
لحضرتك
this is not much difference. If you know, it is only for your medical interest. I need to know what is the origin for my interest. But for sake of the patient, he sent it to chemotherapy. I just forget also, if the female, if the wife say, this patient have dyspnea, so what shall we do?
Yes, I will start to give palliative treatment. I give some drug to decrease the fluid inside the tummy of your husband because the compression in the diaphragm
Okay.
at the chest, and I will
So
do some
can
aspiration.
advise for aspiration. So we can aspirate it. So can have what is called ascites drainage or something like that. So can be option. Okay.
دكتور
So
بس
this
السؤال
is
لما
easy
هي بتقول لك
station.
لما هي
Don't
بتقول
make
لك
it
انا ممكن،
difficult.
لما بتقول
Yes.
لك هي ممكن اني اكلم اخوه في استراليا، المفروض حتكون ايه الاجابه يعني؟
This is means that if this patient is in terminal stage, so you can ask him to come. He must come
Yes.
because this is in the stage. He don't see maybe later. It is not a
Yeah.
fracture. Suppose this patient have a fracture. Okay, he no need to see
معنى كده
him.
يا دكتور انا اللي فهمته من اللجنه دي كل الطلبه هم زي ما قلت حضرتك عمالين بيعملوا الابولوجايز ومش قادرين يقولوا لها في وشها للوايف ان جوزك عنده كانسر. فانا في اللحظه دي المفروض اني ما ارحمهاش، يعني هقول لها كل الحقائق لان الشيء مش متعلق بها هي في حد ذاتها، يعني متعلق بالهازبند بتاعها، فلازم تكون هي ملمه بكل الداتا، يعني ما نكونش هنا نبرر لها يعني ان هي لا هي مش كانسر لسه مش متاكدين. انا هعمل لك هقول لها المختصر والنتيجه النهائيه يعني.
Yes, usually in the British culture, if the patient have a cancer, is not becoming panic, not like in our country in Middle East. These people, he knows that have a cancer, okay, so I can go to visit many places, I can go to something like that. So it's different culture, they accept that. But if you don't tell him that you have a cancer, he discovers that he have a cancer, he's become upset from that. So you must tell him the truth.
وانا اعتقد يا دكتور ان حتى بنص الكنديديت الفيلد في الستيشن دي يعني بيحاول وكانه يغلط النتيجه بتاع الفاينيدال اسبيريشن وبيستصغر، يعني بعد مؤاخذه بعد حضرتك انه بيستصغر في المستشفى، يعني لما بتقول له هي مستشفى صغير ويقول لها معك حق وكذا. فهذه واحده من الحاجات اللي انا بعتبرها ان هي بتدير فيلد يعني.
Yes. It is easy, but I think the student make it complicated. Okay, the last station is also related to spleen, but at this time, It is a splenic haematoma. So anyone need to take it. It is just came this
can.
year. Osama. Okay. All right. So you can see here. So 32 years old, traveled to attend the rugby match. Back to his trip, he had car accident, left side upper abdomen, lower chest, very painful when he take a deep breath. After ABCD, airway, breathing, circulation, and disability evaluation, chest x-ray, fast scan, show fracture left 9, 10, 11 reps, splenic haematoma. Patient admitted under observation, surgical ward. Patient insisted to leave the hospital in evening as he have important interview tomorrow morning, can affect job career. You are Dr. Richard, ward nurse call you because the patient is insisted to leave. Okay, you can read it again and
Okay.
we can ask you.
Okay.
Okay.
We will start. Doctor.
All right, you can start. Okay.
Hello. Hello.
Hello.
My name Dr. Richard.
Yes.
Are your name of Mr. Joe?
Yes, I am Joe.
Yes. I mentioned.
The nurse call you that I need to leave. اوكي. هو أسامة دايما okay, we just waiting him. Okay, so what is suspected the first question? Any one of you, what is the first question? Why you need to leave? Okay, so I need to leave because tomorrow I apply for a job, I have interview, and this is important job in my career.
But your condition is there's some sort of hematoma to your spleen, which is an important organ in your.
Yeah, but I see my data. I ask the nurse my blood pressure, my pulse. I am okay, just a little pain. I can take analgesic.
Okay, but your condition may be deteriorate in any time, and
What you mean by deteriorated?
The spleen may be bleed in any time. There is
So how come it is bleed? It is not bleed now. Why come he bleed at any time?
with hematoma, the chance of spontaneous rupture causing internal hemorrhage can occur. If it will happen, it would need an urgent operation.
Because the reps, you have a fracture rep, so you can have bleeding at this time. Okay, I will speak about spleen to you later, but how to solve this problem? I am insisted to leave because this is my career. I can take a big job. So how to solve this problem, doctor?
We can arrange the ambulance to take it to your job and return you
To the site of the interview, waiting you, and back to the hospital. This is the good answer. If the patient insisted to and refuse, what is the second answer?
Okay, I can't discharge you at the medical.
Against the medical advice. Okay?
Yes.
Against the medical advice. So, Osama, back again, we start with him again. So, Osama, welcome back. All right. So, we start with you again. No problem.
Yes. Hello.
You are in Morocco
yes,
now, or which country?
No, in Libya. Libya.
Libya. Okay, you are welcome. Okay,
Yes.
so what shall you do?
I
Ask me. I need to
yes,
leave because I have a job tomorrow. What is the
yes.
first question? Just ask me the first question. What is the first question?
Yes, the nurses tell me you need to leave to the hospital. Please, can you tell me why you need to leave the hospital?
Yes,
Please,
because I have interview tomorrow, so I need to go to my house to take a shower, to take my suit, and attend the meeting tomorrow. Because this is
Yeah.
good career and good promotion. They give me big salary.
Okay, that's nice. But let me inform you why we need to keep you in the hospital.
I don't know
Because
what I have, doctor. What I have, by the way.
yes, you have you come to hospital. You have the trauma in the left lower chest at this side here, and have a fracture in the lower ribs. that's lead to the effective in your spleen. The spleen, it is the solid organ here, and I take the draw and assemble the spleen. And
Okay,
you
so
have,
what is the treatment for that?
yes, at this time we need to keep it you and conservative for you.
But
And so
what you give me today, or what you give to me, what medication you give to me?
yes, give you
Painkiller and chest
some
physiotherapy
and
and
check your blood.
antibiotic. So I can take this
Yes,
painkiller and I can do this chest physiotherapy in my house. So why you need to keep me here?
okay, but yes, okay, but let me explain you why we need keep it you here, because maybe at any time that lead to the blood in the beside the spleen and the capsule here, maybe that lead to the increase and lead to the bleed and maybe affect of your life. That's why we
So
keep
if
it
it
you
is
here.
happened, I can come to the hospital. I can take a taxi and come to you.
I'm sorry about that, but this is affected in your life. Maybe you can't able to take the taxi or take the car. That's why.
All right. So means that this bleeding can be faster. So I don't even
Yeah.
can come to the hospital. All right.
Yes, that's
So
why.
can give me solution for this problem, bro. For my job, I must go to tomorrow. So what shall I do?
Yes, I don't worry about that. I will to facilitate you and prepare you maybe to contact with your manager and go maybe need to facilitate you meeting Zoom in the hospital here and talk with
No,
your
they need to meet me in person. So we can start. I ask him, can I have Microsoft Team? He say no, we need to in personal.
okay, and I maybe call your manager and I will call and talk with your manager about this job and I will inform him about your situation and what you have.
Okay, you can make it more easier, Osama. You can send
Mhm.
it by ambulance.
ما عرفتش اجاوب صراحة.
You can send it by ambulance.
Okay. Okay.
Okay, so tomorrow morning you can ask your brother or anyone of your house just to bring the suit to you or clothes, and we send you by ambulance. Just to finish the interview, maybe take half an hour and back to the hospital. If they
Yes.
insisted, if insisted, okay, so we sign a consent for discharge against medical advice. All
Okay.
right. So you need to have a solution. Just simple solution is not necessary to be bad doctor and say, okay, you can go and sign the consent. He can also go, but you can just explain to the patient, you have a problem, so we can solve this problem simply by send you by the ambulance. It is the interview can take half an hour, no problem. Or as you suggest, you can make a Microsoft Team or meeting or Zoom or whatever. So it is just communication skills is a way of communication, how to communicate with the patient. Because in most of the country, even in Europe, they consider the good doctor have a good communication. He don't know your skill as a surgeon, but he said this is good doctor. He gave me the
Yeah.
chance. He saved my life, or he preserved my job and become grateful for you because he don't lost his job. Okay.
Yes, and mhm.
Uh, I just stop recording and we can talk to you. All right.
Yes، انا في
So
واحده صاحبتي عملت الامتحان فقالت لها